If you sometimes forget why you walked into a room, or struggle to recall a name that's right on the tip of your tongue, you might shrug it off as normal. It happens to everyone. But what if these small lapses aren't just age? What if they're early messages from your brain, quiet warnings that something deeper is changing? Dementia does not arrive overnight. It builds slowly in subtle shifts that can be hard to spotting, especially in yourself. And yet, when recognized early, it can be managed. There are treatments, therapies, and lifestyle adjustments proven to slow its progression and protect independence. That's why awareness is not fear, it's protection. And it begins with knowing the earliest signs. Here are 10 of them, backed by science, often dismissed as just getting older, but too important to ignore. We'll count them down, from 10 to 1, because sometimes what's easiest to overlook turns out to be the most important of all. Number 10, memory loss that disrupts daily life. Everyone forgets now and then. But forgetting recently learned information again and again is different. It's not simply misplacing your glasses, it's forgetting you wear them at all. People experiencing early dementia often ask the same question repeatedly or forget important dates they just discussed. Long-term memories stay strong, but new ones fade quickly. That gap between what you can remember and what you just learned is the early warning sign doctors watch for most closely. When memory problems start interfering with daily routines, it's time to pay attention, not panic, but awareness. Number 9, difficulty completing familiar tasks. Sometimes the first clue isn't memory, it's confusion in action. Balancing a checkbook, cooking a familiar recipe, using the TV remote or smartphone you've handled for years. These activities rely on something called procedural memory, the brain's how-to system. When that system falters, simple tasks feel foreign. You might skip steps, lose your place, or need to reread instructions you once knew by heart. Researchers call this a breakdown in executive function, the coordination of planning, attention, and sequencing. It's not clumsiness. It's an early sign the brain is processing more slowly. Number 8, language problems. You know exactly what you want to say, but the word just won't come. You pause mid-sentence, circle around the idea, or describe the object instead of naming it. That thing you write with, instead of pen. Occasional word-finding trouble is normal. But when these gaps appear constantly, or when conversation feels exhausting, it can point to early cortical language changes. People may also start reading less or find it hard to follow stories or group discussions. If speech becomes halting or comprehension slips, it's not laziness or distraction. It's a signal worth checking. Number 7, disorientation to time and place. Losing track of a day now and then isn't unusual. But confusion about the month, the season, or how you arrived somewhere familiar, that's something else. At first, it shows up subtly, mixing up appointments, dressing for the wrong weather, or arriving at a destination but not remembering the drive. Later, it can become losing the sense of direction, even in known neighborhoods. This kind of spatial and temporal disorientation often marks the early spread of dementia to the hippocampus, the brain's navigation and timekeeping center. Catching it early can help prevent safety risks before they grow. Number 6, poor judgment and decision-making. We all make bad choices occasionally. But when sound judgment erodes, it shows in everyday patterns: unsafe driving, neglected bills, or trusting people who shouldn't be trusted. One of the first warning areas doctors look for is financial behavior. Sudden generosity, falling for scams, or unusual spending can all signal early decline in risk evaluation, a hallmark of dementia's impact on the frontal lobes. This isn't irresponsibility. It's neurological change. An early discussion with family or a healthcare provider can prevent serious consequences later on. Number 5, misplacing things and being unable to retrace steps. We all lose keys. But people in early dementia often put objects in completely illogical places, a remote in the fridge, a wallet in the washing machine, and can't retrace how it happened. It's not about forgetfulness, it's about the loss of logical mapping in the brain. That's why simply trying harder to remember doesn't help. The spatial memory loop is disrupted. These moments often create frustration or even suspicion, thinking others moved the items. Recognizing the pattern early can help families respond with understanding instead of conflict. Number 4, withdrawal from social activities and changes in mood or personality. This is one of the most overlooked signs. A person who once loved gatherings begins avoiding them. Not because they've lost interest, but because following conversation feels harder or fear of embarrassment grows. Mood changes also appear early. Anxiety, irritability, or sudden apathy often show up months before clear cognitive symptoms. Brain imaging studies link these shifts to early structural changes in the limbic system, the brain's emotional network. When someone who is social becomes distant or unusually quiet, that's not simply aging. It's often the mind protecting itself from overwhelm. Number 3, changes in sleep patterns and walking speed. You might not think the way you sleep or move could signal brain health, but they can. Researchers at Harvard and Kyoto Medical School have shown that disrupted sleep cycles and slower walking speeds are measurable early markers of cognitive decline. People may wake frequently, stay awake at night, or nap throughout the day. Others begin walking with smaller, slower steps, showing early motor planning changes in brain regions also linked to memory. Sleep and movement are windows into the brain's rhythm. When that rhythm changes, it's worth paying attention. Number 2, visual and spatial difficulties. If you suddenly struggle with stairs, misjudge distances, or have trouble reading even with good eyesight, the problem might not be your eyes. It could be your brain's processing of visual information. In early Alzheimer's and related dementias, the occipital and parietal regions, responsible for depth perception and spatial awareness, begin to lose coordination. That's why driving, parking, or navigating new environments can become stressful long before memory loss seems obvious. Subtle vision spatial changes are one of the strongest early predictors doctors measure in cognitive testing. Number 1, inability to learn or retain new information. This is where many early cases begin, not forgetting the past, but struggling to hold on to the present. You can follow instructions one moment, but the next, it's gone. You reread the same note, and it still feels new. This happens because the hippocampus, the brain's short-term memory hub, is the first to be affected in most dementias. Studies show that once new information retention starts to fail consistently, cognitive intervention becomes most urgent. If you notice yourself or a loved one repeating tasks, re-asking questions, or depending heavily on reminders, it's time to seek evaluation. Early testing doesn't label you, it informs you. And information gives you control. So why does knowing these 10 signs matter so much? Because early recognition means early action. Lifestyle changes, cognitive therapy, medication, and structured support can all delay progression. Families can plan, adapt, and protect quality of life. Ignoring the early signs costs time, and time is the one thing you can't regain. Dementia doesn't erase who you are overnight. It begins quietly, but it can be slowed and sometimes stabilized with awareness and care. If you notice even one persistent change in memory, speech, mood, or movement, talk to a professional. You're not overreacting. You're acting early. Because aging doesn't mean losing yourself. It means learning to listen sooner. Stay observant. Stay connected. And remember, recognizing the early signs isn't about fear. It's about protecting your mind, your independence, and your life.